If you are over 60 and waking up at night because your feet feel like they are burning, or you constantly sense invisible insects crawling across your skin, even though nothing is there, what I am about to share could change everything. Between 20 and 40% of seniors have a simple vitamin deficiency that most doctors never check for, and it could be the hidden cause behind your symptoms. Today, we are going to explore the connection between vitamin B12 deficiency and the numbness, tingling, and burning sensations in your legs and feet, especially after age 60. Most people, including many physicians, automatically think of diabetes when they hear about these symptoms in older adults. That makes sense because diabetes is indeed the most common cause. But here is something that might surprise you. In roughly 25% of peripheral neuropathy cases, doctors cannot identify the underlying cause despite running extensive tests. Blood sugar looks fine, thyroid function appears normal, and yet the symptoms persist or even worsen. There is one simple, affordable test that frequently gets overlooked, and that is a vitamin B12 test. In this video, you will discover why people over 60 are particularly vulnerable to B12 deficiency, how to recognize the warning signs throughout your body, and most importantly, how to request the right tests to catch this early. And at the end, I will reveal a specialized test that many people have never heard of, one that can detect B12 problems even when standard blood work comes back normal. Let me start by explaining what is actually happening inside your body when you experience these uncomfortable sensations. That burning feeling that makes bed sheets unbearable, that strange tingling like ants marching across your feet. These are not imaginary experiences. They are real symptoms of a condition called peripheral neuropathy, which simply means damage to the nerves that extend from your brain and spinal cord to the rest of your body. Think of these nerves like the electrical wiring system in your home. They carry signals that tell you when something is too hot, too cold, or pressing too hard. They instruct your muscles when to move, and even regulate functions you never think about, like digestion and blood pressure. When these nerves become damaged, the signals get scrambled or blocked entirely, and that is when those distressing sensations begin. Now, diabetes remains the leading cause of peripheral neuropathy worldwide. Approximately 50% of people with diabetes will develop some form of nerve damage during their lifetime. However, here is the diagnostic gap that frustrates both patients and doctors. In about 1/4 of all neuropathy cases, every standard test comes back normal, and no clear cause emerges. Patients leave their appointments confused and discouraged, often told that their symptoms are simply part of getting older. But that explanation rarely satisfies anyone, and it should not satisfy you either. If you are experiencing these symptoms and have been told there is no identifiable cause, do not accept that answer. There may be a straightforward solution waiting to be discovered. So, what is this overlooked test, and why does it matter so much for those of us over 60? The answer is vitamin B12. This essential nutrient plays a critical role in maintaining healthy nerves. Imagine B12 as the protective insulation wrapped around electrical wires. Without adequate insulation, the signals cannot travel properly, wires can short circuit, and the entire system malfunctions. That is precisely what happens in your nervous system when B12 runs low. The protective coating around your nerve fibers begins to deteriorate, signals become distorted, and you start experiencing tingling, numbness, pain, and weakness. What makes this particularly concerning is that B12 deficiency produces symptoms virtually identical to diabetic neuropathy. Yet, it often goes undetected because physicians are trained to consider the most common causes first. Why are people over 60 especially susceptible to this deficiency? 3 main reasons explain this vulnerability. First, your stomach produces less acid as you age, and your body needs that acid to extract B12 from the foods you eat. Second, many commonly prescribed medications interfere with B12 absorption. Metformin, which millions take for diabetes, and proton pump inhibitors like omeprazole or lansoprazole for heartburn can significantly reduce your B12 levels over time. Third, some individuals develop a condition called pernicious anemia, where the body simply cannot absorb B12 no matter how much they consume. Research suggests that approximately 20% of adults over 60 have low B12 levels without knowing it, and in certain populations, that number can reach 40%. If you are currently taking metformin or acid-reducing medications, you belong to a higher risk group. Understanding this gives you the power to proactively request B12 testing, rather than waiting until symptoms become severe. I am curious, Are you currently taking metformin or acid-reducing medications? Type number 1 if yes, number 2 if no. This helps me understand our community better and create content that truly serves your needs. Now let me paint a picture of what typically unfolds when B12 deficiency goes unrecognized. Imagine this scenario. You are in your 60s or 70s, and you begin noticing that your feet feel slightly numb or tingly, particularly at night. Perhaps you are having some difficulty with balance. You mention these concerns to your doctor during your annual physical. They order a fasting blood sugar test, maybe an A1C test, to screen for diabetes. The results come back normal or borderline. Your doctor tells you it is probably just part of aging, or perhaps they prescribe a pain medication to manage the discomfort. Months pass, maybe even years, and your symptoms gradually intensify. What nobody checked was your B12 level. Throughout all that time, your nerves have been slowly deteriorating because they are not receiving the nutrition they desperately require. Here is the genuinely encouraging news, and this is critically important to understand. When B12 deficiency is caught early, the nerve damage can often be completely reversed. I want you to really absorb that. Caught early, this damage is frequently reversible. But here is the essential caveat. If you wait too long, if the nerve damage becomes severe and prolonged, even correcting the B12 deficiency will not fully restore your nerve function. Some damage becomes permanent. That is why early detection is not merely important. It could mean the difference between complete recovery and living with irreversible damage. You deserve to know this information so you can take action before it is too late. But B12 deficiency does not limit its effects to your feet. There are other symptoms you might never connect to a vitamin problem. You might feel unusually exhausted despite getting adequate sleep. You may find yourself becoming short of breath more easily than before. Your tongue might feel sore or appear swollen. Mood changes can occur, including depression or anxiety that seems to come from nowhere. Memory problems may develop. And here is something crucial to understand. These cognitive issues are sometimes misdiagnosed as early dementia. You might feel unsteady when walking or struggle to maintain your balance. Some people describe a peculiar sensation of wearing invisible socks or gloves, even when their hands and feet are bare. What makes detecting this deficiency especially challenging is that symptoms typically develop very gradually. You slowly adapt to feeling a little more tired. You attribute balance issues to simply getting older. You do not connect all these dots until you suddenly realize your quality of life has significantly declined. If you recognize yourself in any of these symptoms, particularly if you are experiencing several simultaneously, this could be your body trying to communicate something important. The reassuring part is that it can be easily tested. If you are still watching and finding this information valuable, type yes in the comments below. This lets me know this content matters to you, and every comment motivates me to continue sharing health knowledge that can make a real difference in your life. So, what exactly should you do about this? Let us discuss testing, and I will share that specialized test I promised you earlier. The first step is asking your doctor specifically for a B12 blood test. Do not assume it has been included in your routine blood work, because it usually is not, unless you specifically request it. The test is simple, inexpensive, and covered by most insurance plans. Normal B12 levels are generally considered to be above 200 picograms per milliliter. However, here is something important that many people and even some doctors do not realize. Some experts believe that levels below 400 can still cause symptoms in certain individuals, particularly neurological symptoms. So, even if your doctor says your level is technically normal, if you are experiencing symptoms and your level falls on the lower end of normal, it may be worth discussing treatment anyway. And now, here is the information I promised at the beginning of this video. If your B12 level comes back in the normal range, but you are still experiencing symptoms, ask your doctor about an MMA test. That stands for methylmalonic acid. Research has shown that MMA is actually a more accurate indicator of functional B12 deficiency than the standard B12 blood test. Sometimes your body is not utilizing B12 efficiently, even when blood levels appear adequate. The MMA test can reveal this hidden deficiency when standard testing misses it. This knowledge empowers you to advocate for the right tests, rather than accepting normal results that do not match how you feel. If testing confirms low B12, treatment typically involves either high-dose oral supplements or B12 injections. For people with absorption problems, injections are often more effective because they bypass the digestive system entirely and deliver B12 directly into your bloodstream. The encouraging news about B12 is that it is water-soluble, meaning your body simply excretes any excess through urine. This makes it very difficult to take too much, and supplementation is generally quite safe. Regarding prevention, B12 occurs naturally in animal products, including meat, poultry, fish, eggs, and dairy. If you follow a vegetarian or vegan diet, you are at higher risk and should definitely consider fortified foods or supplements. But even if you consume plenty of animal products, remember that for older adults, the issue is often absorption rather than intake. That is why many experts recommend that everyone over 50 consider taking a B12 supplement as a preventive measure. Now you have the knowledge to request the right tests. Not just standard B12, but MMA testing if needed. This is how you take control of your own health, being proactive rather than simply waiting and hoping. Before we conclude, I want to ensure you have the complete picture, because B12 deficiency is not the only possible cause of these symptoms. I want to be completely clear about something. Not every case of leg numbness or neuropathy after 60 is caused by B12 deficiency. Claiming otherwise would be inaccurate and irresponsible. Diabetes remains the leading cause, affecting approximately half of all diabetics eventually. Chemotherapy drugs can cause nerve damage as a side effect. Certain infections, including COVID-19, hepatitis, and Lyme disease, can trigger neuropathy. Autoimmune conditions like lupus and rheumatoid arthritis can attack your nerves. Excessive alcohol consumption is directly toxic to nerve tissue. Exposure to heavy metals like mercury, lead, and arsenic causes nerve damage. And there are rare inherited forms of neuropathy that run in families. In about 25% of cases, doctors cannot identify a specific cause. But many of these patients share common risk factors, including obesity, high cholesterol, and elevated blood pressure. Overall metabolic health becomes increasingly important as we age. Here is what I want you to take away from this. Do not ignore your symptoms. Leg numbness, tingling, and pain are not normal parts of aging. They are signals that something requires attention. Schedule an appointment with your doctor and be specific about what you are experiencing. Request B12 testing and MMA testing if needed, along with blood sugar and thyroid function screening. If you are taking medications that might affect B12 absorption, discuss this with your healthcare provider. Address risk factors through healthy lifestyle choices. Your symptoms matter. Your quality of life matters. You deserve answers that address root causes, not just medications that mask symptoms. Do not let anyone dismiss your concerns as simply part of getting older. Advocate for yourself, because no one else will do it for you. As we have explored today, vitamin B12 deficiency is a common, treatable, and frequently overlooked cause of peripheral neuropathy, especially in those over 60. Early detection can truly be the difference between complete recovery and permanent damage. Now I would love to hear from you. What surprised you most in today's video? Share your thoughts in the comments below. If this information could help someone you care about, please share this video with them. Hit the like button to help more people find this important information, and subscribe with notifications on so you never miss our upcoming health videos. I believe that knowledge is power, and what you learned today can help you maintain your health and independence for years to come. We have prepared additional videos on nerve health and nutrition for those over 50. Check the description below to watch. As always, discuss with your doctor before starting any new supplements. Thank you for watching, and here is to your health.